Question 1. Which of the following is a common cause of left-sided heart failure? A. Chronic kidney disease. B. Hypertension. C. Asthma. D. Gastritis. Answer: B. Hypertension. Rationale: hypertension is a major cause of left-sided heart failure because it increases the afterload, making the heart work harder, leading to ventricular hypertrophy and eventually heart failure. The other options are not direct causes of left-sided heart failure. Question 2. What is the primary treatment goal for a patient with heart failure? A. To eliminate all symptoms. B. To reduce the workload on the heart. C. To increase heart rate. D. To initiate dialysis. Answer: B. To reduce the workload on the heart. Rationale: the primary goal in treating heart failure is to reduce the heart's workload by using medications like ACE inhibitors, beta blockers, and diuretics to improve heart function and prevent exacerbations. Question 3. Which of the following symptoms is most commonly associated with right-sided heart failure? A. Shortness of breath. B. Peripheral edema. C. Chest pain. D. Hemoptysis. Answer: B. Peripheral edema. Rationale: right-sided heart failure often leads to fluid accumulation in the body, causing swelling, especially in the lower extremities. Shortness of breath is more common in left-sided heart failure. Question 4. A patient with heart failure presents with a dry cough and an elevated BNP level. Which of the following medications is most likely contributing to the patient's symptoms? A. Furosemide. B. Spironolactone. C. Enalapril. D. Metoprolol. Answer: C. Enalapril. Rationale: enalapril is an ACE inhibitor, which can cause a persistent dry cough in some patients. BNP, B-type natriuretic peptide, levels are elevated in heart failure and may indicate worsening symptoms. Question 5. What is the primary effect of diuretics in the management of heart failure? A. Increase blood pressure. B. Improve myocardial contractility. C. Decrease fluid volume. D. Decrease heart rate. Answer: C. Decrease fluid volume. Rationale: diuretics work by removing excess fluid from the body, reducing the volume the heart has to pump, thereby decreasing edema and improving symptoms in heart failure. Question 6. A patient with heart failure is prescribed a beta blocker. Which of the following is the most important nursing action before administering the medication? A. Assess the patient's blood glucose level. B. Check the patient's blood pressure and heart rate. C. Monitor the patient's urine output. D. Obtain a chest X-ray. Answer: B. Check the patient's blood pressure and heart rate. Rationale: beta blockers can lower heart rate and blood pressure. Therefore, it is essential to assess these vital signs before administering the medication to avoid causing bradycardia or hypotension. Question 7. What is the hallmark symptom of left-sided heart failure? A. Peripheral edema. B. Jugular vein distension. C. Pulmonary congestion. D. Weight loss. Answer: C. Pulmonary congestion. Rationale: left-sided heart failure often causes fluid buildup in the lungs, leading to pulmonary congestion, which manifests as shortness of breath, crackles, and decreased oxygen saturation. Question 8. Which of the following lifestyle changes is most important for a patient with heart failure? A. Increasing salt intake. B. Maintaining a sedentary lifestyle. C. Limiting fluid intake. D. Smoking cessation. Answer: D. Smoking cessation. Rationale: smoking cessation is critical in heart failure management because smoking can further damage the cardiovascular system, worsening heart failure. The other options are not beneficial in managing heart failure. Question 9. Which of the following diagnostic tests is commonly used to confirm the diagnosis of heart failure? A. Electrocardiogram ECG. B. Chest X-ray. C. B-type natriuretic peptide BNP test. D. Liver function tests. Answer: C. B-type natriuretic peptide (BNP) test. Rationale: the BNP test measures the level of BNP, which is elevated in heart failure, helping to confirm the diagnosis and assess the severity. Question 10. A patient with heart failure is experiencing dyspnea and orthopnea. What is the most appropriate nursing intervention? A. Elevate the legs. B. Place the patient in a low Fowler's position. C. Encourage deep breathing exercises. D. Place the patient in high Fowler's position. Answer: D. Place the patient in high Fowler's position. Rationale: high Fowler's position helps improve respiratory function and alleviate symptoms of dyspnea and orthopnea in patients with heart failure. Question 11. Which of the following medications is commonly prescribed to reduce afterload in heart failure? A. Digoxin. B. Furosemide. C. Lisinopril. D. Spironolactone. Answer: C. Lisinopril. Rationale: lisinopril, an ACE inhibitor, helps reduce afterload by dilating blood vessels, making it easier for the heart to pump blood and improving heart failure symptoms. Question 12. Which of the following signs indicates worsening heart failure? A. Weight loss. B. Decreased respiratory rate. C. Increased shortness of breath. D. Decreased BNP levels. Answer: C. Increased shortness of breath. Rationale: increased shortness of breath, especially with exertion, can indicate worsening heart failure due to fluid buildup in the lungs. Question 13. A patient with heart failure is prescribed spironolactone. What is the most important lab value to monitor? A. Potassium. B. Sodium. C. Calcium. D. Creatinine. Answer: A. Potassium. Rationale: spironolactone is a potassium-sparing diuretic, so it is important to monitor potassium levels to prevent hyperkalemia. Question 14. A nurse is teaching a patient with heart failure about daily weight monitoring. What is the most important information to include in the teaching? A. Weigh yourself at the same time every day. B. Use a different scale every day for accuracy. C. Weigh yourself only once a week. D. Weigh yourself after eating breakfast. Answer: A. Weigh yourself at the same time every day. Rationale: consistent daily weighing at the same time, preferably in the morning before eating, helps monitor fluid retention and detect early signs of heart failure exacerbation. Question 15. Which of the following is a priority intervention for a patient with acute decompensated heart failure? A. Administering a diuretic. B. Giving a corticosteroid. C. Starting 4 fluids. D. Encouraging ambulation. Answer: A. Administering a diuretic. Rationale: diuretics help remove excess fluid from the body, which is critical in managing acute decompensated heart failure and relieving symptoms like edema and dyspnea. Question 16. What is a common side effect of ACE inhibitors used in heart failure management? A. Rash. B. Weight gain. C. Dry cough. D. Increased appetite. Answer: C. Dry cough. Rationale: a dry cough is a common side effect of ACE inhibitors due to the accumulation of bradykinin. Question 17. A patient with heart failure is receiving education about sodium restriction. What is the most appropriate dietary recommendation? A. Avoid canned vegetables. B. Add salt to meals to improve taste. C. Eat fast food once a week. D. Drink at least 2 liters of water daily. Answer: A. Avoid canned vegetables. Rationale: canned vegetables often contain high levels of sodium, which can exacerbate heart failure symptoms. Question 18. Which of the following should be avoided in a patient with heart failure to prevent fluid overload? A. Increased physical activity. B. Dehydration. C. Excessive sodium intake. D. Diuretic therapy. Answer: C. Excessive sodium intake. Rationale: Excessive sodium intake can lead to fluid retention and worsen heart failure symptoms. Question 19. What is a primary benefit of using an inotropic agent like digoxin in heart failure? A. It increases heart rate. B. It reduces fluid volume. C. It enhances myocardial contractility. D. It improves renal function. Answer. C. It enhances myocardial contractility. Rationale. Digoxin increases the force of myocardial contraction, which helps improve cardiac output in patients with heart failure. Question 20. What is the most important aspect of patient education for heart failure management? A. Emphasizing the importance of daily exercise. B. Explaining the need for salt and fluid restriction. C. Encouraging the patient to discontinue medications if feeling better. D. Advising the patient to avoid all physical activity. Answer. B. Explaining the need for salt and fluid restriction. Rationale. Salt and fluid restriction help prevent fluid retention, which is critical in managing heart failure symptoms and preventing exacerbations. Question 21. A patient with heart failure presents with new-onset confusion and elevated serum creatinine. Which of the following is the most likely cause of these symptoms? A. Hyperkalemia. B. Hypoxia. C. Acute kidney injury. D. Electrolyte imbalance. Answer. C. Acute kidney injury. Rationale. Elevated serum creatinine indicates kidney dysfunction, which is common in heart failure due to poor renal perfusion. This can lead to confusion due to electrolyte disturbances and waste accumulation. Question 22. A nurse is administering furosemide to a heart failure patient. What is the most important action to take immediately after administration? A. Assess heart rate. B. Check for signs of hypokalemia. C. Monitor blood pressure. D. Assess for edema. Answer. C. Monitor blood pressure. Rationale. Furosemide is a potent diuretic that can cause hypotension. Monitoring blood pressure ensures the patient does not experience a dangerous drop in blood pressure. Question 23. Which of the following is the most appropriate strategy for managing fluid volume overload in a patient with heart failure? A. Increase sodium intake. B. Limit potassium intake. C. Administer intravenous fluids. D. Implement strict fluid restriction. Answer. D. Implement strict fluid restriction. Rationale. Strict fluid restriction is essential in managing fluid overload, which helps prevent worsening of heart failure and reduces the risk of pulmonary edema. Question 24. A patient with heart failure presents with pink, frothy sputum and shortness of breath. What is the nurse's priority action? A. Administer oxygen. B. Increase fluid intake. C. Administer a beta blocker. D. Elevate the legs. Answer. A. Administer oxygen. Rationale. Pink, frothy sputum and shortness of breath are signs of pulmonary edema, which requires immediate oxygen therapy to improve oxygenation and prevent further complications. Question 25. A heart failure patient's ejection fraction is 30%. What does this imply about the patient's heart function? A. Normal cardiac output. B. Severe systolic dysfunction. C. Good heart function. D. Preserved diastolic function. Answer. B. Severe systolic dysfunction. Rationale. An ejection fraction of 30% indicates severe systolic dysfunction, meaning the heart is unable to effectively pump blood, which is characteristic of heart failure with reduced ejection fraction, HFrEF. Question 26. A patient with heart failure is receiving an ACE inhibitor. Which of the following electrolyte imbalances should the nurse monitor for? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hypercalcemia. Answer. A. Hyperkalemia. Rationale. ACE inhibitors can increase potassium levels by inhibiting aldosterone, which leads to decreased potassium excretion. Monitoring for hyperkalemia is important to avoid life-threatening arrhythmias. Question 27. A patient with heart failure is experiencing a worsening of symptoms despite optimal treatment. What should be the nurse's next step? A. Increase diuretic dosage. B. Initiate mechanical ventilation. C. Recommend the patient go to sleep. D. Contact the healthcare provider. Answer. D. Contact the healthcare provider. Rationale: worsening symptoms, such as increased shortness of breath or edema, require urgent reassessment by a healthcare provider to adjust the treatment plan, including possibly increasing medications or addressing other underlying issues. Question 28. Which of the following would be the most appropriate nursing diagnosis for a patient with heart failure who has limited mobility and is on strict bed rest? A. Risk for impaired skin integrity. B. Risk for ineffective breathing pattern. C. Impaired gas exchange. D. Acute pain. Answer. A. Risk for impaired skin integrity. Rationale: prolonged bed rest and limited mobility increase the risk for pressure ulcers and impaired skin integrity, which requires vigilant skin assessment and preventive measures. Question 29. A nurse is assessing a patient with heart failure who is receiving digoxin. Which of the following symptoms should prompt the nurse to withhold the medication and notify the healthcare provider? A. Tachycardia. B. Hypotension. C. Bradycardia. D. Increased urine output. Answer. C. Bradycardia. Rationale: digoxin can cause bradycardia, and the medication should be withheld if the heart rate is below 60 beats per minute to prevent further cardiac complications. Question 30. A patient with heart failure is demonstrating poor adherence to their medication regimen. What is the best approach to improve medication compliance? A. Increase the dosage of medication. B. Provide detailed written instructions. C. Encourage noncompliance as a temporary measure. D. Refer the patient to physical therapy. Answer. B. Provide detailed written instructions. Rationale: providing clear, written instructions and educating the patient about the importance of medication adherence helps improve compliance and reduces the risk of exacerbations. Question 31. A nurse is preparing a patient with heart failure for discharge. Which of the following is a priority in the discharge teaching? A. The importance of daily weight monitoring. B. The need to perform daily physical activity. C. The use of over-the-counter medications. D. The dietary inclusion of processed foods. Answer. A. The importance of daily weight monitoring. Rationale: monitoring daily weight is critical in heart failure management, as rapid weight gain can indicate fluid retention, signaling worsening heart failure. Question 32. A heart failure patient with renal insufficiency is prescribed spironolactone. What is the nurse's priority action? A. Monitor for signs of dehydration. B. Check for hyperkalemia. C. Assess the patient's mental status. D. Measure abdominal girth. Answer. B. Check for hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic, and renal insufficiency increases the risk of hyperkalemia. Regular monitoring of potassium levels is crucial to avoid dangerous complications. Question 33. A patient with heart failure is prescribed an implantable cardioverter defibrillator, ICD. What is the primary benefit of this device? A. It reduces fluid overload. B. It helps to increase heart rate. C. It prevents sudden cardiac death. D. It improves myocardial contractility. Answer. C. It prevents sudden cardiac death. Rationale: an ICD helps prevent sudden cardiac death by detecting life-threatening arrhythmias and delivering a shock to restore normal rhythm. Question 34. A patient with heart failure is having difficulty maintaining oxygen saturation during exertion. Which action should the nurse take first? A. Provide supplemental oxygen. B. Decrease the patient's fluid intake. C. Administer diuretics. D. Place the patient in a side-lying position. Answer: A. Provide supplemental oxygen. Rationale: providing supplemental oxygen immediately addresses hypoxia and helps improve oxygen saturation levels, allowing the patient to breathe more easily during exertion. Question 35. In heart failure management, which of the following is considered an early intervention to prevent the progression of the disease? A. Starting digoxin therapy. B. Initiating mechanical circulatory support. C. Administering ACE inhibitors. D. Prescribing diuretics only. Answer: C. Administering ACE inhibitors. Rationale: ACE inhibitors help prevent the progression of heart failure by reducing afterload and improving cardiac output, making them a key early intervention. Question 36. A patient with heart failure is experiencing increased anxiety. Which intervention is most appropriate to reduce anxiety? A. Provide information about the disease and treatment plan. B. Administer a sedative immediately. C. Encourage the patient to take deep breaths. D. Increase the dose of diuretics. Answer: A. Provide information about the disease and treatment plan. Rationale: educating the patient about their condition and treatment plan can help alleviate anxiety by improving understanding and promoting a sense of control. Question 37. A nurse is monitoring a patient with heart failure who is on a sodium-restricted diet. Which food item should the nurse avoid recommending to this patient? A. Fresh vegetables. B. Canned soups. C. Grilled chicken. D. Brown rice. Answer: B. Canned soups. Rationale: canned soups often contain high amounts of sodium, which can worsen heart failure symptoms by causing fluid retention. Question 38. Which of the following is the most appropriate long-term strategy for preventing hospital readmissions in patients with heart failure? A. Administering aggressive diuretic therapy. B. Educating patients on medication adherence and lifestyle changes. C. Restricting physical activity completely. D. Scheduling frequent in-person visits. Answer: B. Educating patients on medication adherence and lifestyle changes. Rationale: education on proper medication use and lifestyle modifications, like diet and exercise, can significantly reduce readmissions by empowering patients to manage their condition effectively. Question 39. Which of the following signs would be most concerning in a patient with heart failure who is receiving an ACE inhibitor? A. Increased appetite. B. Persistent dry cough. C. Diarrhea. D. Weight loss. Answer: B. Persistent dry cough. Rationale: a persistent dry cough is a well-known side effect of ACE inhibitors due to the accumulation of bradykinin, and it may require discontinuation of the medication. Question 40. Which patient with heart failure should be referred for a heart transplant evaluation? A. A patient with a low ejection fraction and stable symptoms. B. A patient with end-stage heart failure and refractory symptoms. C. A patient with controlled hypertension and no symptoms. D. A patient with chronic arrhythmias and managed symptoms. Answer: B. A patient with end-stage heart failure and refractory symptoms. Rationale: patients with end-stage heart failure who have refractory symptoms despite maximal medical therapy are candidates for heart transplant evaluation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!